When I went to my GP, I was really surprised actually to be offered a physio appointment rather than an appointment with my actual doctor at the GP surgery. The physio was really good, telling me to take regular breaks from work because I work 40 hours a week at a computer, so getting up and walking around, and also changing from paracetamol to ibuprofen, which is an anti-inflammatory. Seeing a physio is really beneficial to my condition because it means that I'm not having to constantly take paracetamol daily, and obviously when they give you the exercises and you do them daily, it's going to stop the pain and gives you more flexibility and just generally well-being in your day-to-day life.
So I'm a registered mental health nurse, working within GP practice, trying to engage mental health in primary care. A lot of my roles are about engagement with patients who are suffering from enduring or severe mental health difficulties, such as anxiety, depression, psychosis, and bridging the gap really between primary and secondary care, working alongside GPs. There's lots of benefits with me being in a GP practice for patients. One of them is patients have 7 to 10 minutes, or maybe sometimes less, to see a GP, and a lot of times mental health takes a while to formulate what's going on, and there may be many factors, and I think offering more time to patients I think is the key, being able for them to be listened to and validated their concerns. Especially here, you know, I offer 40 minutes to see somebody in which they have time to look at all aspects of their mental health and then come to a more detailed decision on what needs to be done. And I think that's important because I don't think making a formulation of somebody of what's going on within 10 minutes is really difficult, and making that referral to secondary care for them to explore further, sometimes, you know, it can be done more efficiently within the GP practice.
So I've been involved with developing a couple of different streams. So through the EMIS super user group, we've put together protocols that just save time on things like delivering vaccinations, ensuring that you hit targets. And I've also been involved working with OneCare on their physio pilot, creating an integrated kind of cross-system referral service. So you can get what would normally take like a 9-week process to see a physio or speak to a physio. We can whittle it down to about 4 days, and we can save all the GP time in between. EMIS can do the sorts of things you would expect a computer program to be able to do in terms of data crunching, taking out a lot of legwork, you know, a lot of data entry type tasks. EMIS can do automatically for you. And it can also comb the patient record for relevant information. And that's a really powerful aspect of it. It can look for clinical codes in a patient's record, check them against a bunch of criteria, and either flag something up or use that as a criteria for calling them back to get checked and all that kind of stuff.
The real benefit of something like OneCare is not actually how it affects us tomorrow, but actually can we sustain what we're doing over the next 5 to 10 years? Because we know that the only option we don't have is to stay the same. And we know we haven't got enough GPs. We know that the patients are living longer, have more conditions, have higher expectations. So actually we've really got to be functioning at the top of our game to be able to have any chance of survival. And anybody that's a GP in and around Bristol know that there's loads of practices are struggling at the moment and merging and trying to find ways of surviving. And the great thing about OneCare is it gives us a solution. You know, before most people have even asked for it, the solution is already out there. So a lot of the things that we're developing with OneCare, patients and the rest of it, may not really be aware of them yet, but actually it won't take long for them to realise there's an easier and better way, to service their needs, and it will already exist. I mean, the big game changer that will be coming up soon will be the EMIS web read and write, so that we will all be able to access patients' records wherever they are, might be in the Bristol area. And so currently, in the last year, patients sort of come in and see you, new patients come in and see you, and they just are completely dumbfounded by the fact that we don't actually have any medical records for them. They think we're a bit like a bank and they can go into any branch and get exactly the same records. Well, we can't, but we will be able to soon. I think my tips for practices that are new to OneCare, and we know that we've expanded rapidly in the last year from sort of 20 practices to over 70, and I think there's about 103 in South Gloss, Bristol and North Somerset. I think the tip is to embrace it really, because the scale that we have, the resources that we have are there, and they can really make a big difference to the general practice. And sharing our resources means that we can do far more. So my tip to them would be to embrace it and to get to the front and hold your hands up in the air and scream.